Do you have to reach the max dose on Wegovy or Zepbound? For many patients, the answer is no. The best dose is not the biggest pen. It is the dose that gives enough benefit while staying tolerable. Early weight loss can look impressive, but chasing higher doses can make treatment harder to continue for the wrong reason. Wegovy, Semaglutide, and Zepbound, Tirzepatide, are often treated like dose ladders. People start low, climb every few weeks, and assume the top step proves success. But these medicines are not trophies, they are long-term tools. The real question is whether the dose can keep working in real life. A maintenance dose is the long-term dose your doctor keeps after reviewing weight response, side effects, medicines, and key safety risks. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. That dose question matters because hormone effects do not feel identical in every patient. Hormones are chemical messengers that tell organs what to do. These medicines can reduce food drive and slow how fast your stomach empties. The same effect can also make meals, fluids, and dose increases feel harder. That appetite and stomach effect is one reason the dosing schedule starts low. Zepbound 2.5 milligrams, for example, is used for treatment initiation, which means the early starting phase. It is not a maintenance dose. Early steps are there to reduce sudden appetite and stomach effects before long-term dosing begins. If the jump feels too aggressive, nausea, reflux, constipation, or poor intake can dominate the experience. A medicine that becomes a weekly punishment is already losing part of its value. Confusing a starting step with a long-term target creates unnecessary pressure. The label gives the clue. Maximum dose is not mandatory for every patient in weight loss treatment. For Zepbound weight management, maintenance can be 5, 10, or 15 milligrams weekly. For Wegovy injection, adult weight management maintenance can be 1.7 or 2.4 milligrams weekly, with 2.4 preferred for many patients. The FDA-approved Wegovy HD, a 7.2 milligram higher dose Wegovy injection in the United States. It is for certain adults who need more effect after tolerating 2.4 milligrams. That approval adds an option for selected patients. It does not replace individualized dose selection. Some strengths are stepping stones, not final destinations. For Zepbound, 7.5 and 12.5 milligrams are dose escalation steps, not recommended maintenance doses for weight reduction. A pen strength can exist without being the long-term target. The dose should serve the patient, not the dosing schedule. This matters when pharmacies list many strengths side by side. Before anyone moves higher, the dose question should split into two parts. First, is the medicine helping enough? Second, is the patient able to live normally on it? Higher dose can help the first problem. It can worsen the second problem. Enough help does not mean only scale weight. It can include hunger control, waist change, blood pressure, blood sugar, and daily function. A patient losing steadily on Zepbound 5 milligrams may not need 15. A patient doing well on Wegovy 1.7 may not need another step. Side effects are not just annoyances. Repeated vomiting can cause dehydration, meaning too little fluid in the body. Severe constipation can become unsafe, and poor intake can make older adults weaker. For some patients, the dose problem is not lack of strength, it is loss of function. A bigger dose can create a smaller life. It may make protein, fluids, and normal meals difficult. Fullness should make choices easier. It should not turn basic nutrition into a chore. If treatment removes nutrition, the dose needs review before another increase. This matters more in people with kidney problems, dizziness, reflux, constipation history, or multiple blood pressure medicines. Vomiting, diarrhea, and low intake can reduce fluid in the bloodstream. That can worsen lightheadedness or kidney strain. In that situation, a smaller stable dose may beat a larger unstable dose. That individual difference is why copying someone online can be a trap. Their dose may match their body, insurance plan, side effects, and goal weight. Your body may respond earlier. Your body may also need more time. Copying another patient's dose skips the part that makes treatment medical. After you stop comparing yourself with others, the next step is not always increase or stop. Doctors may hold the dose rather than cancel treatment. Holding the dose gives symptoms time to settle before the next step. That can prevent a temporary side effect from becoming a permanent stop. To decide whether to hold, increase, or reduce, the pattern across several weeks matters. Track weight trend, hunger before meals, evening cravings, bowel rhythm, nausea, and energy. Also track whether protein and fluids are realistic. A dose that blocks eating too much can still be wrong if it blocks eating enough. Plateaus need careful interpretation. A plateau means weight stops falling for a period despite continued treatment. It does not always mean the dose failed. Weight loss naturally slows as the body becomes smaller. The right response may be nutrition review, activity review, patience, or dose change. After a plateau is reviewed, the next question is the treatment goal. Some patients need more weight loss to lower risk. Some need weight maintenance after a large drop. Others need a safer dose because side effects are limiting the treatment plan. The same pen strength can be reasonable in one goal and wrong in another. Dose increase makes sense only in specific situations. It fits when hunger returns strongly, weight is rising, and side effects are mild. Before increasing, your doctor should consider gallbladder symptoms, kidney risk, other medicines, and pancreatitis, meaning inflammation of the pancreas. If the increase criteria are not met, holding the dose may be better. It makes sense when progress is steady. It also makes sense after significant nausea, vomiting, constipation, dizziness, or poor fluid intake. Dose reduction can fit when side effects persist or appetite control remains strong after major weight loss. Even after a medically reasonable dose choice is clear, insurance can distort the conversation. Some plans cover certain strengths differently, and shortages can pressure patients toward whatever pen is available. Those are practical barriers, not proof that one strength is medically best. Coverage and supply should not define the safest dose for your body. The medical question remains benefit, safety, and daily function. Whatever insurance or supply pressure exists, call your doctor before changing doses yourself. Do not double doses to catch up. Do not jump ahead because progress feels slow. Call promptly for severe abdominal pain, repeated vomiting, dehydration signs, fainting, or symptoms of low blood sugar. Those safety problems need medical guidance, not self-adjusting at home. When you call, avoid a vague report. Say your current weekly dose, weeks on it, recent dose changes, and missed doses. Include body weight trend, worst side effect, and whether you can keep fluids down. Also mention severe belly pain, fainting, or low blood sugar symptoms. Those details help your doctor decide whether to hold, increase, reduce, or evaluate urgently. The summary is this: you do not have to reach maximum dose to have a valid result. You need a dose that produces enough benefit, remains tolerable, and fits your risk profile. The smartest dose is not the loudest dose. It is the dose you can live with over time. Dose is a tool, not a finish line. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.